Hello everybody, welcome to Healthy Habits. Today we'll be talking about knowing if you have depression, a topic that is misunderstood or mistaken for feelings of a certain situation, moments of grief, or any other conditions that have similar symptoms to depression. With this being said, I'll be explaining the difference between these conditions and actual depression. Subscribe and hit that notification bell to be notified when I upload next, and let's get straight into the video. Number 1. Difficulty concentrating. Do you find it difficult to complete regular tasks because of a lack of focus? The inability to focus or concentrate is a common symptom of depression, which can even result in losing a train of thought during a conversation. You could be experiencing a more challenging work and social life due to depression, along with memory issues. Number 2. Smiling depression. Say you go out in public and for some reason you feel that you have to put on a smile just to get through the day. Those who are hiding depression will force a smile when around others as if nothing is wrong. You might gain anxiety about what others think about you, or feel that people think you're unreliable even though you haven't done anything of that nature. You may also recognize that you need help but you aren't sure how to get it. Number 3. Irritability. Having sudden feelings of annoyance or being bothered by others during the day and seeming uneasy can be a sign of depression. You may attain feelings of anger instead of sadness and show sudden changes in mood, giving the impression that you don't want to be bothered. Changes in your mood are also common with depression, but many people think it's something else. Number 4. Losing interest in activities. The lack of once enjoyed hobbies and activities are common signs of depression. You could be pursuing tennis for a couple of weeks, but then all of a sudden you just don't want to do it the next day, and sooner or later not at all. This behavior is also linked to bipolar disorder and anxiety, which can all interfere with and aggravate one another. Number 5. A drastic change in appetite. Whether you find yourself eating more or less than usual, it could all mean something much greater. Depression itself can trigger an overeating or undereating coping mechanism. This is applied particularly if you choose to do either one for emotional relief. You can find yourself never being satisfied when it comes to your appetite. Number 6. Feeling fatigued throughout the day. Depression consists of numerous symptoms and side effects that literally takes the energy from doing normal, everyday things, since all of the work is going on in your head. This can lead to sleep apnea and other sleeping disorders, since it's inevitable to be a recurring cycle. Sleeping far into the day or getting too much sleep is also a common side effect. Regular sleeping habits are important to the recovery process, so when you take that time away from your body, you become drowsy and depressed. 16 million American adults get depressed every year, and worldwide there are more than 300 million on a day-to-day basis. Anybody can develop this condition no matter what age or type of person you are. Only 6% of adults get treatment, and this is solely off of medication. Although the outcome doesn't sound pretty, I do recommend you watch my previous video about gaining clarity of depression. I talk about the ways to prevent these side effects in depression itself. Subscribe and click the notification bell to be notified when I upload next, and I'll see you in the next video. Peace.